Hi, I'm Gautam Kulkarni. I'm a children's doctor in London, and welcome to my YouTube channel. This is going to be a super fun health education channel for parents, children, and even doctors. The health conditions covered are all inspired by real patient stories.
Constipation is one of the commonest causes of chronic pain in young children all over the world. Our changing lifestyles means that it is affecting even more children, and can affect between 5 to 30% of the child population. It is often underdiagnosed, undertreated and not managed very well. This is often the reason why some children suffer needlessly into adulthood. Children with disabilities such as autism and developmental delays suffer even more and for longer. This is because they are not able to verbalize their discomfort, and their underlying medical problems predispose them to get constipated. In my personal practice, I approach children with constipation, thinking of the word pain. This is a good way to understand both the causes and consequences of chronic constipation. These factors can be interrelated. For instance, a cow's milk protein allergy may cause mild inflammation of the gut. This may cause pain while passing stools. Chronic pain may trigger psychological responses of withholding. This may over time cause anatomical changes in the muscles. It's worth remembering though, that in the majority of children with chronic constipation, it may not be possible to identify any triggers initially. Previous painful experience due to passing hard stools can cause withholding behavior. Children might try their very best by stiffening, squeezing buttock muscles, crying, or crossing the legs. Many children may struggle with changes in routines, such as nappies, or passing stools in new environment. This may cause a significant delay in toilet training. Anxiety about passing stools, or starting a new school or nursery can be common triggers. This may lead to school refusal or severe anxiety. Chronic constipation, especially associated with withholding, can cause low self-esteem and friendship issues. It's not easy for young children to drink large volumes of medicines, which in itself can trigger discomfort and a sense of failure, especially when medications don't seem to work. The entire family could worry about holidays abroad and school trips, when they should be getting excited. We will now look at some of the anatomical factors children can be born with. Hirschsprung's disease is a birth defect, where muscles of the gut don't work because of missing nerves. Hence, a child's intestine can't move stool normally and becomes blocked. This, as well as some other rare anatomical conditions, are normally picked up in newborn babies. Very rarely, some children with short segment Hirschsprung's disease may be picked up only in later childhood. More commonly, chronic constipation causes anatomical problems in rectum. The longer that the stools stay in the rectum, the harder and bigger they get. This is because the natural function of the rectum is to absorb water from the stools, thus making them harder, and the fecal mass starts getting bigger. The rectal wall stretches and this condition is called megarectum. The stretched rectal wall loses its normal contractility to push the stools. Megarectum also means the normal rectal sensation is lost. As a result, children don't often get the normal sensation of needing the toilet. Hence there is an increased risk of incontinence. Megarectum causes large stool volumes to be built up without a sensation of rectal fullness, causing leakage of stools without awareness. Urgency, as there is only a last-minute warning when the stools come out. This can be misunderstood by parents as laziness or not trying hard. Sometimes soiling is wrongly thought as diarrhea. In some children, it's clear that an allergy or intolerance could have been the initial trigger. Cow's milk and gluten sensitivity or celiac disease can be responsible in some children. Often, as children get older, they might partially outgrow their intolerances, thus making the diagnosis difficult. However, the anatomical changes described previously may take years to reverse. Some children with neurological problems are predisposed to chronic constipation. It is important to understand that children with cerebral palsy, autism, developmental delay, are at a higher risk of constipation. A spinal exam should look for signs of neural tube defects, such as hair tufts in the midline. Early and effective treatment of their constipation may significantly improve their quality of life by reducing pain, and help improve appetite and toilet training. Always consider hypothyroidism in an older child. if there are any other factors suggesting this. Acute onset of constipation is quite common after viral infections and periods of hospitalization and improves quickly. In an acutely unwell child, who presents with constipation, a pediatrician will always look for red flag signs which prompts further investigations. Weakness, especially in the legs, abnormal sensation associated with constipation, should prompt an assessment with a specialist right away. In addition to weakness described previously, other red flag signs include constipation from birth, or starting very early, which should prompt a referral for Hirschsprung's disease. Acute abdominal distension and significant vomiting are also concerning. Amber flags include faltering growth, developmental delay, or any concerns regarding the child's well-being. It's important to remember that most children's constipation is idiopathic in nature. Idiopathic is a condition which arises spontaneously, where the cause is unknown. However, there are effective treatment strategies which can optimize outcomes. A specialist constipation nurse may customize treatment for the individual child, especially in complex situations. We will be covering more topics, including how to give children medications for constipation and advice from specialist nurses in subsequent videos. Thank you for watching. Please subscribe to our channel, and kindly do watch the videos on milk allergy and celiac disease.